HRT is prescribed by a doctor, and when you go and see your doctor to talk about your symptoms, there'll be a number of questions that the doctor's asking to come to the right type of HRT for you. So first question is, have you had a hysterectomy? If you haven't had a hysterectomy, you need estrogen and progestogen. If you have had a hysterectomy, you only need the estrogen. The second question that they'd ask is, are you still having periods? So if it's within around a year of your last period, we'd give you a type of HRT called sequential HRT, where you have the estrogen all the time, every day, and then you have the progestogen for half of the month, unless you have a Mirena coil fit. If it is more than a year or thereabouts from your last period, you take the type of HRT called continuous combined HRT, where you have estrogen every day and a small dose of progestogen every single day. It's really important that you do take the progestogen, because if you have estrogen only HRT and you have got your womb intact, estrogen can thicken the womb lining and significantly increase your risk of cancer of the womb. If you take the progestogen, it removes that risk. So many women experience side effects from taking the progestogen, particularly initially. So it's really important to go back and talk to your doctor if that's you, because there will be ways of changing it so it's more tolerable to you. The final question that your doctor will ask is, are there any risk factors for blood clots on legs and lungs? Is there a risk of heart disease? Because for many, many women, it will be safer to have the estrogen component through the skin as patch, gel, spray, rather than swallowing it. And then also it's personal preference. So a good discussion about what type of HRT you'd like to take is the sort of final important piece of the consultation. You can buy vaginal estrogen now over the counter. It's called Gina. It's a vaginal estrogen and it's equivalent to Vagifem or Vigirux. There are quite strict criteria as to who can be sold it over the counter, so you would definitely need a conversation with the pharmacist. So not every woman can buy it, but it can be a really effective way of managing vaginal and, for some women, bladder symptoms of the menopause.